What is it?
I'll just hand over the thing to my host, Dr. Pankaj Patel.
Done. Okay, done. Am I clear and am I audible to you?
Yes, sir.
Yes. Okay, fine.
So I welcome all the participants again for the next session of Scope of Physiotherapy Practice by Dr. Ali Irani. He is a renowned and honored personality in the field of physiotherapy. His proficiency is highly sought after in the sports world. He was a physiotherapist for Indian cricket team from 1987 to 1997 and has extensive experience working with professional athletes at state and national level. He has also helped several famous Bollywood celebrities recover from serious injuries. For the educational background, Dr. Irani graduated from reputed MS University, Baroda, and completed his PhD in sports medicine and PhD in anatomy of body movement and dance. Presently, he is the head of the Department of Physiotherapy, Sports Medicine and Rehabilitation Center at Balabai Nanavati Hospital, Mumbai. He is also the president of Indian Association of Physiotherapists and the vice president of Bombay District Sports Medicine Association. He has done intensive research on key topics like knee mobility, backache, fitness, and sports injuries and frozen shoulder. He presented several papers on the same topics at various national and international conferences. He is the visiting faculty and PhD guide at various universities across India. He has more than 30 years of experience in the field of physiotherapy and awarded many prestigious awards owing to his contribution to this field and community. So,
Pankaj, there's a small correction.
Yes, sir.
Sir is currently the president of Women's, the international head of Indian Association of Physiotherapy.
Yes, sir. I'm so sorry.
Yeah. And secondly, sir is also to all the participants. Sir is also a physiotherapist for the most of the Bollywood actors, like Shah Rukh Khan, and sports persons like Sachin Tendulkar or other personalities. So this is for kind of information to all of you. Over to you, sir. Ali Irani, sir. Unmute your mic, sir.
Okay. Good morning, everybody. Sorry I'm late by 10 minutes. As usual, Mumbai traffic and parking problems. I hope all of you all have cleared with good marks in your 12th standard science and you all are looking forward for a bright future. Just to explain you all what is physiotherapy. During your studies of your 10th, 11th and 12th, most of you all went through a lot of neck problem, neck pain. And neck pain, almost 80 people out of 100, they have neck pain. So you can take your neck forward, but when you want to take it backward, it pains. Only a physiotherapy can treat it. You must have taken tablet for it. The tablet will block the pain, will not treat the pain. So as and when your parents, you are seeing your parents are taking tablet for the knee problem, for the back problem, shoulder problem. So these tablets only block the pain. So if mechanically you want to treat the pain, why the pain is coming, so it is the role of a physiotherapist. So a physiotherapist, if you go to see, does not only treat so that you get relief from pain. A physiotherapist tries to find out the reason why you get the pain, and we sort out, we align the body, we treat mechanically what is going wrong. So you have to understand. Then we say we are from before the mother, when the mother gets pregnant, before a child is born. So let me explain when your mother was pregnant. So if she would have gone through physiotherapy, we do the strengthening exercises, breathing exercises for the mothers so that they do a safe delivery and a normal delivery. So we have a role to play. So if your mother would have gone to physiotherapist, your first session of physiotherapy was when your mother was pregnant and you were still in the fetus. Then as you come out, when you come out, we help you all. If there is any deformity, to correction of your posture, breathing exercises, good expansion, Then God forbids when the children have got cerebral palsy, polio, autism, so the mothers have to take people for physiotherapy. Then as you grow, you start going to school. Most of the school children, almost 15% of the school children have scoliosis, that the spine is not straight. It bends at a lower level because of your school bag, lifting the school bag at one level or sitting in an angle and writing. Nobody sits and writes straight. We sit in an angle and write. So there's a deformity of the spine called scoliosis. So as a school child, physiotherapist plays an important role. Most of the big schools in Bombay have a physiotherapist attached to them to do the deformity correction for the school children. Still you grow elder, you want to become a sports person in school. So physiotherapy helps you to perform better and get better result at your sports. Still you grow, maybe you become any specialist, you become a cricketer, footballer, volleyball player, tennis player, golf player, swimmer. Again, it's any injury, a physiotherapist will look at you. Or a physiotherapist helps you to perform better. And then again, as you grow, you start having problem with your shoulder, with your neck, with your back, with your knee, again, ankle sprain, all that again, a physiotherapist comes in to treat you and see you. So I'm explaining you all in a simple way what all of physiotherapists will be able to do. You still go a little more elder, then again, osteoarthritis of knee, which could be corrected and treated for pain by a physiotherapist. Then you cross 60, you go under the geriatrics group. That is elderly people, right? Or senior citizen, whatever we want to call it. Again, it's the role of a physiotherapist to see that we call it activities of daily living, wearing your shirt, picking up a glass of water or tea and drinking, going to the bathroom, removing your clothes, putting on your clothes. So you should be not dependent on anybody, you should be independent. So it's called activities of daily living, right? So as you still go older, you lose your balance. When you become 70, 80, you start losing your balance, not to fall. You are not being able to wear your clothes. Your balance problem comes. So again, role of physiotherapy in geriatrics, right? So to keep you going, we all want people to live for 120 years, right? But they should be able to be independent. That is where a role of a physiotherapist comes. All your other problem as far as diabetes is concerned, or hypertension is concerned, you have other medical problem, there are other medical specialists which will help you. But if you are regular in your exercises, one, we have to see that you may not get diabetes. If you are walking and doing exercises every day, you may not be, you may not require to take medicine for hypertension. So exercise becomes part of our life. How much to exercise, what exercise to do is all guided and taught by a physiotherapist. Right? So in short, much before you were born, your mother took physiotherapy as prenatal exercises. Till when? Till you are alive, you need physiotherapy to be able to be independent and be able to do exercise of daily living. So till then, it is again role of a physiotherapist. Physiotherapy started way back in 1952 in India with a 2-year course. It was called a diploma course, started from Mumbai, right? Then the second college came up in Vellore, then in Chennai, then in Calcutta, then in Delhi, then in Nagpur. And last was Baroda. 7 colleges of physiotherapy was there. The 7th one when I was studying was Baroda. And it was by Baroda because Baroda was the only college started by WHO. And it was called a degree college. So we came out of diploma and became a degree college for 3.5 years. And it was called MS University, B Physio, Bachelor in Physiotherapy. And I am a student from Baroda. I left Mumbai to come and study in Baroda, gave the entrance exam of Baroda, and there is to be only 20 seats. So coming to from Bombay to Baroda only because it was a degree college. But dear students, after I joined Indian cricket team in 1987, I was the first physiotherapist for any sports team in India, any sports team. No sports team had any physio. So when I joined in 87, people started seeing me on television. Any cricketer getting injured, I had to run and treat them on the ground. And today we are 250 physiotherapy colleges in India. Highest number. Gujarat had only one college, Baroda. And today Gujarat has maximum number of colleges in any state. 75 colleges only in Gujarat for physiotherapy. Because most of the physiotherapists were in demand. They used to go to USA, UK, New Zealand, Australia, Canada. They used to get better jobs immediately there because our course is 4.5 years now. So when you do physiotherapy, it's 4.5 years. You can go to Canada, you can go to Australia, you can go to New Zealand, you can go to USA, you can go to UK and do your postgraduate or give the license exam and start working, right? So the demand is so much. Today we have got more than 7,000 physiotherapists from India who are working in USA. So the demand of Indian physiotherapists increased because we are 4.5 years. In USA, you can be a graduate by in any health science subject. You can be a graduate and then go for your DPT. That is doctorate in physiotherapy only in 3 years. So actual physiotherapy is 3 years, whereas we are doing 4.5 years. That's why an Indian physiotherapist is in demand. Coming to what all you can do in India after doing 4.5 years, you can do your post-graduation MPT 2 years, and you can do Charusat University also has, right? Changa also has PhD, has post-graduation and PhD programs. So you can go up to your doctorate. You can go do PhD in physiotherapy from your one university. So it may be a one window, join Changa and first become a B physio, then become an M physio, and then take your PhD. There are many guides. Dr. Bala is a guide. Dr. Dhruv is a guide there. At once upon a time, I was a guide of same university. I still come regularly to Changa. Whenever I come, I see to it. I talk to the students. I take a lecture for the students. So it's a lovely campus. They have a good tie-up with the hospitals, number of patients, the research studies which are being done there by the students are lovely. I had an opportunity of seeing many interns. Many students came as an intern to Nanavati Hospital and they were brilliant. They were good. I have no complaints about the students coming from Changa compared to students coming from other universities. So as a profession, we are looking forward. Everybody needs. 80% of the Indians have some problem for which they have to go to a physiotherapist. Overall, if you go to see, more than 80% people have neck problem, more than 50% have back problem, more than 40-50% have got knee problem. So all this type of patient, then we get hemiplegia as we grow, hypertension, so we may get one side paralysis, again seen by a physiotherapist. Only a physiotherapist can get you back walking and doing your normal activities. Then you may get fractures by accident or playing or something. Again, after the fracture has healed, to get the full mobility and to get the strength is the role of a physiotherapist. So physiotherapists have a big role to play in human being. It's not only treatment. Please understand, physiotherapists also prevent. We are also in prevention, right? Again, we are into disaster management. We had the Bhuj earthquake. We had the Kashmir Uri earthquake. It was the physiotherapists who were in the forefront working. There's a big physiotherapy center which has come up in Bidra in Bhuj. It was because of physiotherapists. It's one of the biggest physiotherapy center in India. It is 16,000 square feet physiotherapy center in Bhuj, Bidra. Why? Because they came to know the importance of physiotherapy after any disaster. Rehabilitation played an important part. So we are into any type of rehabilitation, whether it's a car injury, sports injury, whether it's now COVID injury. We have a COVID rehab. We have to again do rehab for the lungs. All are those who are suffering from COVID, those who get corona positive, and when they become negative, we are working on their lungs. We work on the lung expansion. We want the vital capacity of the lungs to increase. So there's a whole program called lung rehabilitation or rehabilitation of respiratory system. So we play a role there and big job. We are frontline. All my student and staffs are in the COVID ward. They're treating them, wearing a PPE. They come out after 6 hours because the PPE life is 6 hours. So once they go in, they have to come out of the ward or seeing the patient after 6 hours. I would if anything left, you can ask me so I can answer the questions.
Yes, so there are some questions. How about our role in fitness industries?
We are in charge. So if you are into sports fitness, you are responsible for the fitness. But there are many physiotherapists attached to gyms. Almost all the Talwarkars had a physiotherapist with them. All the pretty slim, the fitness centers, the fitness program people, they cannot do without a physiotherapist. See, the word physiotherapy, if you go to see, it has to do with movement science. Anything to do with movement, we become the charge, we become the boss for it.
So another question is, how about PT scope in foreign countries?
I said 7,000 Indian physios are in USA. There are more than 1,000 in Australia. There'll be at least 25, 30 in New Zealand because it's a small country. Any hospital will need a physiotherapy center. We cannot. You need to put salt in food, whatever you make. So whichever the specialty, physiotherapy is like a salt in the food.
So then next is it necessary after finishing graduation to do post-graduation in BPT or physiotherapy?
If you want to get into teaching or specialize. But I've got many staff senior to me, they have only done BPT. With BPT, Bachelor in Physiotherapy, you have a right to open a clinic, you have a right to directly practice. And Gujarat Council is very strong. We have a physiotherapy council in Gujarat. They're allowed to see the patient directly. So you don't need to be postgraduate to see a patient.
So the next is, can anyone do PhD after BPT?
No,
Right,
you have to do an MPT, post-graduation, and then.
okay.
To reach the third floor, you have to walk the second floor. Now. You have to cross second floor to go to third floor. From first floor, you can't go to third floor.
So the next is, how about our role in community physiotherapy?
Community-based rehabilitation is one of the specialty of MPT. 70% of Indians live in rural area. They also need physiotherapy. My students regularly go to camps at Gujarat-Maharashtra border. We treat the Adivasis. We regularly go to Lonavala. We regularly go to Raipur, Jalgaon, away from Mumbai. We work in rural areas only because 30% people live in city, right? And 70% of the people live in rural area. So, and especially your university has a great scope because all around you are small villages. And thank God, even the students who did their PhD studies, they got an opportunity to do it on the rural people, the rural section of the country.
So this is nowadays trend is towards the DPT. So can anyone join DPT straight away?
No, DPT is for people who want to practice in USA. Please understand. They have not put it into practice. Long back, 10 years back, WCPT said, which is now called World Physiotherapy. They said, okay, if you want to practice in USA from 2020, you should be having DPT. So people who are BPT, who are MPT from India, they used to go and do the lateral entry study. They used to just go and do the DPT there and practice if you want to practice and put a clinic. But in India, that rule is not there. So with BPT only, you can, straight from BPT, you can open a clinic. So not necessary that you have to do DPT in India. DPT is only for USA, till not put into action. But maybe once it is put into action and you want to settle in USA, you will have to do DPT. You can start working, give your license exam, start working and still do DPT. There are online courses also for DPT, which you can do now also. Right? So I can tell Bala the details how to go about it. Being in India, you can do DPT from Canada, you can do DPT from Spain, you can do DPT from Florida.
So sir, there is one more question. One student is want to know about scoping neurophysiotherapy. For
Tremendous. See the patient, see the car accident. Every 4 minutes there is a car accident, and most of them are become a neuro patient. Then we have got hemiplegia, one side paralysis because of hypertension and other reasons. So, and then neuroscience is divided into two. We have pediatric neuro and adult neuro. So there is enough cases for pediatric. Many people have centers only for pediatric neuro and then adult neuro.
Okay, so the next is our degree of BPT from India valid in foreign countries like USA, Canada, New
Why
Zealand?
not? If you are an IIP member, it's valid. You have to see, to practice in USA, you have to give the license exam. But to join MPT, there is no problem. I said 7,000 physios who are in USA from India, they all have Indian degrees, na? They are all having the clinics, they are practicing there. And we are in demand. From any other country, people who apply for physiotherapy, the first taken will be an Indian physio.
So one of the students is eager to know about the steps of success of the place that you have right now and how one should got there and how you have suffered, and can you share your experience in this field?
When we were studying 3.5 year course in Baroda, we were called Malishwala, we were called Kasratwala and all that thing. But now see the name, everybody wants to call you a doctor. Right? So the change is that.
Okay.
You raise your standard. You raise your standard to a level that even God should ask you, what do you want?
Can one should take registration in state council or IAP or both?
Both. State council is an honor to practice in your state. And IAP is Indian Association of Physiotherapists is attached to now World Physiotherapy. World Physiotherapy is attached to WHO, World Health Organization. So it's a status for you. Tomorrow suddenly you will get married in USA or New Zealand or England. You don't know where your boy will be from. So don't do a mistake. As soon as you finish your internship, every physiotherapist, every student should become an IAP member and state council member. Gujarat council is one of the best in the country.
So how about this field for females?
Why not? 80% of the physios in this country are females.
Yes. So nowadays there are courses like Master of Science in Kinesiology. So kinesiology is a part of
Specialty, yeah.
Yes.
It's a specialty.
Okay.
So you can do acupuncture, you can do dry needling, you can do taping, you can only do joint mobilization, you can do spinal mobilization. Nowadays, there are organ mobilization. So it's unending. First, they thought when you do physiotherapy, you are attached to an orthopedic surgeon. But as we went ahead, we have gone in super specialties. We are into neuro. Neuro got subdivided into adult neuro, pediatric neuro. We went into cardio. Then we had exercise physiology, chest physiotherapy. We went into musculoskeletal. Then we had sports medicine. Then we had fractures. We had joint replacement, spinal mobilization. Getting it? So there is no end to our specialization.
There's one more question. How much one may be able to earn from this field?
We are consultant. It depends on you. Right? We have mechanic who will be working on a salary of 2,000 rupees, and we have mechanic who touch your car and you start the car and close it, they want 5,000 rupees. We are consultant. We are not clinic and salary walas. So if really you want to prove yourself, show your specialty. See how good you are. You may get 1,000 a month also, and you can get 10 lakh rupees a month also. It depends how good you are. We are not policemen, na? Fixed salary. If you are a Havaldar, this is the salary. If you are sub-inspector, this is the salary. Our profession is not salary based. You study to become a consultant, to become a specialist. We have physios who only see hand. They are hand specialists. We have physios who only see spine. We have physiotherapists who only treat migraine, nothing else, and they are earning well. So we are not salary based. For salary based, you should study something else, IPS, IAS, and all that, and think about the salary.
So I think this was it, sir. Any tip for our future physios?
Pardon? Correct.
Any tips for our future physios?
We are into a healing profession. We heal. I can only say that physiotherapy will be very soon one of the best profession in the country because we heal. patient comes crying to us and they smile and go. We reduce their pain, we get their mobility back, we rehab them. And I can only pray and tell all the newcomers or those who want to do physiotherapy that may God give you a healing hand. I hope you are working for Changa.
Yes, sir, I am.
Rest up.
Yes, yes.
God bless you also.
Thank you, sir.
You're a very nice patient and you took all the questions.
Thank you, sir.
So you have to be, I'm sorry if I have been nasty to you.
No, no, sir. Thank you so much, sir, for the informative session. Anyone have any questions?
So I got one question.
Yes, Bala.
Physiotherapy as of now, after 5 years, how it will be?
I said one of the best profession in the country. Bala, we are going, you don't know what COVID has done to us. I feel Corona coming in, COVID coming in is going to only raise our standard. You
Okay.
have to come and see what our students and staff are doing for COVID patient in Nanavati. Yesterday's paper showed that 22 of the people who recovered and who were negative in KEM hospital have got lung fibrosis because PT was not given. So
Okay.
physiotherapy is going to play a very, very important role. Prevention of COVID, you increase the vital capacity and they won't get it. See
Okay.
that the vital capacity of the patients are 4 liters, 3 liters. So that you have to buy at least 8-10 of spirometers and put all your students knowing about it. This is just 2.5 liters.
Okay.
Right? But we have the 5 liter one also, right? But that our target should be that. See this. This is for 5 liters. And I challenge you, all your students, whether nursing, physiotherapy, pharmacy, engineering, they all will be below 2 liters. Lung capacity is 4.5 to 5 liter. So why conjugacy? We are not taking proper breath. We have to expand our chest now, increase the volume of the lung because Corona attacks the lung. So after 5 years, just see now onwards, we will be the most wanted one for COVID rehabilitation.
Okay.
And please do it in your rural areas, especially people who have recovered, go and increase their vital capacity.
Sure, sir. We will be working on it. Thank you, sir. Thank you for the time.
Thank you and all the best. Students, all the best to you all. Welcome to physiotherapy.
Hello, sir.
Thank you, sir.
Hello.
Thanks.
Thank you, sir.
Could be talking on phone.
Could be any question is there?
Yes, sir.
Go
Sir,
ahead.
what is the role of PT in astronaut conditioning?
Astronaut. Nobody has joined NASA, but I'm hopeful. See, many physiotherapists have gone for Miss India. Many physiotherapists have gone in different fields, but we have not gone. Many have gone into marketing. They are doing very well. Many physios have become, good MDs of different things. We have entered into dermatology. We have went into Pretty Slim. Many other, but nobody has joined NASA. So one of the physios going to USA should apply to NASA. So there should be a physiotherapist entering NASA also. We have a role to play. Increase of vital capacity, good strength, strengthening our proper posture, alignment of all the muscles and body.
Okay, thank you, sir.
Thank you, sir.
Thank you. All the best.
Thank you.
Bye, Bala.
Thank you, sir. Thank you all the participants for joining. Here we end the session. So thank you. We'll see you tomorrow.
Dhruv. So Dhruv.
Thank you, sir. Thanks a lot.
Bye-bye.
Bye, sir.
Take care. I'm leaving now.